first bullet point says it's voluntary. Participation is voluntary, therefore withdrawal, the ability to stop participation would have to be voluntary and be able to be given and respected at any time. And obviously that did not happen previously. And there has to be procedures in place and a decision-making model for when to end the study. And if there are problems that arise, and knowing what those are, the need to stop it. And again, my focus is not on conducting research. It's going to be much more on clinical work. But this, again, this is to give you a history. Prior to 1947, none of this existed. So these are some of the basic points that we take that are relevant to how we do informed consent today. And again, I'll highlight other steps and rulings that have had an impact on this. But that, again, it has to be voluntary and can't be coerced. Bring him in and all this. I'm like, well, this is really a complex situation because neither of the two adults who brought him in can consent. They don't have the legal right. And he doesn't have the legal right. And I was like, wait a second. How old are you? When was your birthday? And in Maryland, there's a law that minors who are 16 or 17 years of age have the same legal right as adults to consent to any healthcare treatment to a licensed physician, a licensed psychologist, or a healthcare facility. So not a social worker or counselor in private practice, but it's just, and this has to do with lobbying and the legislature and how they write laws, but a 16 or 17-year-old can consent to their own healthcare for a licensed psychologist, licensed physician, or any healthcare facility in the state. He had just turned 16 like 10 days ago. You get to follow that reasonableness standard. But certainly the nature, purpose, and anticipated course of treatment, you know, basically what are the services being offered? I mean, I think most people want to know that. You know, is this psychotherapy? Is this neuropsychological testing? Is this just a brief consultation? You know, what's the service? You know, so the nature, purpose, and then say anticipated course. You can't say, and here's the detailed outline of what happens every session, or we'll meet for 12 sessions and then everything's done. But, you know, give a general idea. People want to know, what am I signing up for? What am I getting into? You know, is there homework involved? And do I have to take medicine, or do I come once a week? Do I come once a day? You know, things like that. And then this notion, and this comes from that Osheroff versus Chestnut Lodge case, reasonably available options and alternatives and their relative risks and benefits. You know, when we were doing, you know, cognitive behavioral therapy or supportive counseling or whatever it might have been previously, that's a major change. We want to discuss it and discuss all those elements we talked about earlier of reasonably available options and alternatives, likely risks and benefits, you know, what are the goals, likely outcome, all of that. So just what do we do? That's an excellent question. I'm glad I asked. So there's no one accepted standard for exactly how to do informed consent. I've been highlighting that there's standards on the elements of informed consent, but how you do the informed consent, you do use your professional judgment. Someone in crisis is different than someone not in crisis, and an adult is different than a child, and so on. So you want to be guided by those 4 standards for informed consent to be considered valid. Follow any relevant state laws and regulations.